You've beaten prostate cancer, but no one really told you what happens to your erections or how to protect the tissue long term. That's exactly what this daily low-dose Cialis plan is all about. I'm Melissa Hadley Barrett, sexologist and urology nurse practitioner at Restorative Health Clinic. In this video, I'm going to talk about how a small daily dose of tadalafil, also known as Cialis, can support penile health and heart health after prostate cancer treatment. This video is general information only. It's not individual medical advice, so always check in with your own healthcare provider before starting anything new. After prostate cancer surgery or radiation, the delicate nerves and blood vessels that control the erections can be affected. This can then reduce blood flow, change the tissue inside the penis, and make erections more difficult. Without support, the penis can gradually lose the smooth muscle and develop scar tissue, and even shrink over time. To help with recovery, we often recommend a daily dose of a medicine called a PDE5 inhibitor. You might know these as erectile dysfunction medicines like Cialis or Viagra. For most men, we use tadalafil at a low dose of around 5 to 6 milligrams once a day, or sildenafil at a dose of around 25 to 50 milligrams once a day. The exact dose is tailored to you by your prescriber. These medicines help in several ways. They support blood flow to the penis and help maintain oxygen and tissue health. Over time, that can reduce risk of scarring or shrinkage, which we call fibrosis or atrophy. They also encourage natural nighttime erections, which are really important for your recovery, and they can improve confidence and sexual well-being while your body heals. So the main goal here is supporting recovery rather than guaranteeing a full return of erections. First, let's talk about what the research shows for penile health. Regular use of a PDE5 inhibitor, such as Cialis or Viagra, can prevent the loss of smooth muscle, reduce scarring in penile tissue, and after nerve injury. In men who have had nerve-sparing prostate surgery, daily tadalafil has been shown to improve erections while you're on the treatment, and it may help preserve erectile function over time. After radiotherapy, we don't yet have evidence that tadalafil prevents long-term erectile dysfunction, because the right long-term studies haven't been done. However, tadalafil remains safe and well tolerated for most men, and it does improve penile blood flow and therefore penile health while you're taking it. The best results happen when you're on the medication and when you combine it with other strategies. That might include using a vacuum erection device, a penis pump, doing gentle penile stretching, or working on your pelvic floor exercises, ideally with guidance from a pelvic health physiotherapist. So that's the penis. Now let's move on to something just as important, your heart. Research is showing that tadalafil may also benefit heart health. A large US study of nearly 30,000 men with erectile dysfunction found that men who took tadalafil had about 19% lower major heart events, such as heart attack, stroke, or heart failure. They also had a 44% lower risk of death from any cause, and they had fewer hospital stays for chest pain and heart problems. The greatest benefits were seen in men who took tadalafil consistently over time. Researchers think tadalafil may work in a few ways. It seems to improve blood flow, vessel health, what we call endothelial function. It can reduce inflammation and slightly lower blood pressure. And it appears to help oxygen delivery to the tissues, which may protect the heart cells. Now, this study doesn't prove that tadalafil prevents heart disease, but is very reassuring for men using it long-term for penile rehabilitation or erectile dysfunction. So how do we actually use tadalafil at Restorative Health Clinic when it's safe and appropriate? We usually recommend taking 5 to 6 milligrams once a day at roughly the same time each day. We often start after your healthcare provider gives you the all clear, which is usually soon after the catheter is removed following surgery. In many cases, we suggest continuing for at least 2 years after surgery or for as long as your healthcare specialist advises. For best results, we combine daily tadalafil with other treatments. That might include a vacuum device, penile injections when they're appropriate, and pelvic floor physio or a structured pelvic floor exercise program. Most men tolerate daily tadalafil very well, but like all medicines, it can cause some side effects. The most common ones are a headache, flushing or mild dizziness, a blocked nose, and a bit of indigestion, and some people get mild muscle aches. They usually settle with time. However, if you experience chest pain, fainting, or changes to your vision, you should also seek medical advice straight away. If you get severe muscle pain, stop the medication and contact your prescriber. At Restorative Health Clinic, we will often prescribe sildenafil instead as a replacement. Sildenafil is also helpful for penile health, but it has not been studied in the same way as a daily medicine for heart function. There is one very important safety warning I want to emphasise. You should never take PDE5 inhibitors together with nitrate heart medicines. That includes the GTN spray, nitroglycerin tablets and angina patches. Always talk to your healthcare provider if you have heart disease, low blood pressure or on multiple heart medications before starting tadalafil or any similar medicine. So the bottom line, taking a daily dose of tadalafil can help support penile tissue after prostate cancer treatment, and it may offer heart health benefits as well. I've linked the main MACE study in the show notes if you'd like to dive into the full research. If tadalafil has been prescribed for you, use it regularly as directed, stick with your rehabilitation plan, and stay closely connected with your healthcare team. It's one small daily step that can make a really big difference on your recovery and your long-term health.